that button here. Very good. You are welcome, as you all know, to turn on your cameras. You are welcome to put any questions that you have for our guest speaker in the chat. I'll make sure that I stay on top of those, or unmute yourself. And this is extremely very laid back. You are welcome to unmute yourself and ask your question. Okay. For those of you who do not know me, my name is Jody Durham. I am one of the admissions reps here at Sonoran University. I work very close with Jane. The only difference between Jane and I and what we do is I work with last names A through L, and Jane works with last names M through Z. So some of you may have worked with me, some of you may have worked with Jane, but we both do the same thing. I, this year, will be celebrating my 17th year here at Sonoran University. So I've been here since 2006. Absolutely love what I do. I actually came from the mortgage industry, so you guys can probably imagine how stressful that job was. Absolutely love Sonoran University, as well as SCNM. Those of you know Sonoran as SCNM. So without further ado, I am going to introduce my guest speaker, who is Dr. Dan Wool. Let me give you a little bit of information about Dr. Wool. So Dr. Wool is a licensed ND at Chambers Clinic in Scottsdale, Arizona, specializing on gastroenterology and hormone care, especially for busy professionals over the age of 40. He earned a bachelor's degree from USC, an MBA from ASU, and graduated SCNM in 2018. He is an 18-year Arizona resident, and he enjoys spending time outdoors with his wife, Marley. He also has 2 teenage sons, so he's definitely busy, right? He is a strong believer in the principles of naturopathic medicine and their critical role in complementing Western medicine and preventing disease. You can find Dr. Wool on all socials at Dr. Dan Wool and online at drdanwool.com. So as you all know, I always share at these segments a core value, and core values are beliefs of the institution. We have 5 core values that we definitely stand behind. Today I picked we love. We truly love having the opportunity to work with each and every one of you throughout this process. We also enjoy watching you grow from the very beginning as you are working on your prerequisites all the way to graduation and becoming our alumni and part of our community. Being a part and watching you fulfill your dream is as rewarding to Jane and I as it is to all of you. So again, welcome, Dr. Dan Wool. I am so excited that you are going to be part of this today. As you all know, I do have a list of questions that I asked the guest speaker, but please, 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 we do this for you guys. So please feel free to ask anything at all from Dr. Wool. I'm sure he will be happy to answer it for you. Okay, so anyway, I'm going to start off then, and I start off with the same question to everybody as our guest speaker. So Dr. Wool, how did you first become interested in naturopathic medicine?
Hi, Jody. It's so great to see you again today.
You too.
And Jody and Jane were super instrumental in me making my decision to become a naturopathic doctor. I came at this a little differently. Like many applicants to Sonoran University, this was a second career for me. I had a 20-year career in marketing, communications, public relations, and I got really sick. I actually stressed myself sick and chased around a really bad gut. Burning gut for about 3 years. And every time I go to the doctor, they'd send me home with some different prescription, and nobody actually addressed the root cause. And I used to hike with a group of people, and one of them was seeing a naturopathic doctor for her thyroid and completely turned her around. And she says, you should go see my ND. And so I did, and they figured out what I had right away. which is something called celiac disease. It's an allergy to wheat. I was gluten when gluten wasn't cool. But long story short, when I started to talk to my naturopath about, hey, how come this was so easy for you? Because they turned me around in 3 months, what other doctors couldn't do in 3 years, and started to talk about the principles of naturopathic medicine. And her journey was very similar to my own. Long corporate career, a lot of stress. Jody, I think you're a little bit different as well, but you can relate from becoming out the
Oh,
mortgage
yes.
industry. I came
Oh,
out of Fortune
yes.
500 company right into
Oh,
SCM
yeah.
in Sonoran University now. It also connected a lot of dots with me. When I'd always been a kid who was interested in nature and being outdoors, gardening, herbs, taking supplements and such on my own, and really it made me very, very curious about the medicine itself, and it really drove me. And I really wanted to go and become a naturopathic doctor after that.
And here he is today. Awesome. Good, good. Awesome. So Dr. Wool, and I know you worked with Jane quite a bit, with the last name being
L through Z.
W. Yep. So did you only apply to, at the time, SCNM, or did you apply to the other schools as well?
I only applied to Sonoran University. I'll just use that.
Okay.
I will
Okay.
probably slip back into SCNM at some point because
I do.
it's new. But
Yeah.
the reason that I only applied to Sonoran University was because I lived in the area. At the time I was living in Tempe, Arizona. So I also am a later career professional. As Jody mentioned, I had 2 boys. And so I didn't really want to leave the area that had become accustomed to my family and I. And so I applied to Sonoran University. The other thing, I also learned that Sonoran University was the best as I went through my process. So, I wanted to be with the best. The doctors I was talking to in investigating my journey, that's something I would recommend you all to do. I'll give my contact information at the end of this. Please feel free to ping me and ask any questions. But they all went to this university as well to get their medical degree, and so it really confirmed that this is the place I wanted to be. But it started out as just being geographically desirable.
Okay. Okay. Awesome. By any chance, did you do any kind of residency when you graduated, or how did that go about?
Yeah, I did not do a residency to answer the question
Okay.
directly. A couple things. One, I'm a little bit older. I don't have the runway to just. I just didn't have the runway. I had to get out there and start practicing. I really
Okay.
wanted to start doing that. The second thing is that through the Career Center, I was put in touch with Dr. Keith Chambers, who is the head of Chambers Clinic here in Scottsdale. Dr. Chambers and I have similar backgrounds. He's an incredibly impressive physician and practitioner, and I really just clicked with our clinic. Chambers Clinic is unique in that there are multiple practitioners all within our walls. I think we have 6 NDs who work here. There's a lot of different permutations of how naturopaths operate, but I really like the fact that there were other doctors here that I could talk with and learn from. And that in and of itself was its own sort of residency. So that was another reason I didn't decide to pursue anything formally on the residency front, but because I was getting it already in shadowing the doctors here and getting to know everybody.
Okay. Okay. So you graduated in 2018. When
Yes.
did you start Chambers Clinic?
In April of 2018 is when I started to come
Okay.
by and shadow the doctors here. I would come by a couple times a week. It was not anything formal through the school. The school
Okay.
has curriculum when you get into the clinical education portion where you do formally shadow doctors, and there are hours associated with that. But I went out on my own once this connection was made from the Career Center. I come in a couple days a week, shadow the doctors here. I still came in once a week when I was studying for my boards after we graduated. Dr. Chambers was gracious enough to host me as a preceptor. What that means is that you are an ND graduate, but you have not yet received your license from the board. So there was about a month and a half there while we were waiting for our official licensure to come from the state after passing boards that I was precepting here. So I really started in earnest as a doctor in September of 2018, and then formally once we got the licensing in October of 2018. I'm in year 5 here at Chambers Clinic.
Wow. Wow, that's incredible. That's incredible. And like you said, Dr. Chambers Clinic is amazing. We've seen alumni, do very well there, So yeah, and he's amazing too. So Dr. Wool, what out of all of the modalities, and I know they're all very, very important to an ND as they're practicing, but is there a modality that you focus on more than others? And
Yeah,
if
I
so,
think
yes. If
yes.
so, why?
That was a really great question. Yes, we do use all of them. I think that's the great strength of
Okay.
naturopathic medicine. We have lots of tools in the toolbox, and I think that's critical. We're not following just a simple pharmacological algorithm or surgical algorithm. There's lots of different solutions that we learn through acupuncture, botanicals, homeopathy.
Yeah.
But to answer your question more directly, I probably focus on nutritional medicine the most.
Okay.
And sometimes it's the simple things that we do in our diet that tend to direct the rest of the treatment. Also, that would include things like nutritional supplements. You get an education in this at Sonoran, where we're learning about, what each of them do. It's almost like vitamins and minerals and botanicals as pharmacology, as opposed to just something you go run and grab off the shelf at Sprouts. And that's really, really important to have somebody quarterbacking that, because those things can have the same sorts of potential adverse effects as any medication. So to have somebody who can use these things as adjuncts to help other people, to try to mix that into somebody's treatment plan, is really, really important. So that ends up being the vast majority. It's probably the number one modality I use. I will also say there's one that we're also taught at Sonoran, and that's common sense. I have cracked so many cases as a practitioner, just using normal physiology and anatomy and just common sense, like, wait, did they ask you this, or did they ask you that, or how come this happened? How come all this started, way back, last year at this time? Oh, you were going through a breakup, or somebody in your family died, or, have you done this and have you done that? And you can use these things to direct questioning with patients, and they're the types of conversations that really, people appreciate and that other practitioners just won't ask in their short time with the patient.
Right. And I think that's the key. And we've had many guest speakers on here throughout the time that Jane and I have been doing this. And they always talk about spending the time with their patient and getting to know the patient, and especially asking the questions, so that's extremely important. All right. Alexandra does have a question. So go right ahead, my dear.
Hello, Dr. Wool.
Hello.
I have just a quick question for you as more of a gut expert.
Mm-hmm.
I've been reading a lot and exploring a lot with the microbiome, and obviously like low carb, no gluten, high fiber, like dietary fiber. What is your take on a higher diet based in animal fats and the relation with leaky gut?
So I will just answer it this way. All diets are the exact same. They're all plant dominant diets. And then you layer in style, essentially. If you're somebody who wants to remain plant-based 100%, there's vegetarian and vegan diets for that. What you're talking about is a more fat dominant diet with the plants, and that's more of a ketogenic style diet. It has some benefits for energy and those sorts of things. I think a lot of people do it wrong, and a lot of people don't track very closely their macros. And there's a lot of work that goes into a ketogenic style diet. As long as somebody is performing that sort of a diet and staying in close track with it, and then it tends to do really well. I do a lot of gut dysfunction, and sometimes the first thing that people cannot digest is fats. That's where we see a lot of the burping and bloating, and the first sign that inflammation downstream is starting to cause these, digestive issues. So it really just depends. It's a marketing answer. I think one of the great strengths of our medicine is it's custom. Every situation is a little bit different, and then we can use different modalities to address it. But in general, that's my take on that. I hope that answered your question.
Yeah, definitely. Thank you. I've just seen a lot of things with like obviously like high protein, high veg, and then
Mhm.
reduction of both carbs for more starch, and then like animal based fats and
Yeah.
its relation to leaky gut. But it's kind of hard to sift through because it's not like a, one fix all
Yeah.
situation.
The main thing from leaky gut tends to be inflammation, and the main cause of inflammation is generally stress. And
Mm,
then, and it depends. Every person has a different stressor. Most of it's just what's coming at us every day, not jiving with our genetics. Essentially, we weren't meant to kind of live with computers and texts and all
yeah,
these things that come at us all the time. That's part of it, but some of it could also be, stress from food and diet, or stress from too much exercise. And that's where kind of these lifestyle considerations come into effect. And those are the questions that, Western medicine doctors never ask. Very few of them talk about nutrition. Or if they do, it's just, oh yeah, go eat a healthier diet, or go see a nutritionist.
right.
So there's a lot of fad diets out there and a lot of ideas spinning around online, but I love having the medical background from SCNM. See, I slipped, I did at Sonoran University,
Yeah.
that really helps to kind of look at the big picture and connect dots when it comes to people's health. And, and sometimes it's a very easy tweak to optimize somebody's diet, or somebody's lifestyle. It's something simple. It's usually free that
Yeah.
they can do to become their best, to be in their best state of health. So it's a great question.
Yeah. Good question. Awesome. Any other questions right now before we move on? Burning questions out there, everybody. Burning questions. What do you want to know? No? Yes, Maya? Can you hear me, Maya? And you're welcome to put your question in the chat as well, and I can read that. Okay, that's fine. That's fine. Perfect. So definitely take advantage of the chat, or you just turn off your microphone and ask. This is extremely very, very cordial and laid back. So Dr. Wu will not mind, I promise.
At all.
Let's see. Do you think food is medicine? I have seen it heal my autoimmune.
100%.
Yeah.
Food is what healed my celiac, or not eating wheat healed my
Hmm.
celiac. I lost another 10 pounds after that diagnosis. Nutrition saved my life. And it's the one thing I carried into Sonoran University, into the curriculum, where I went, yeah, no, diet, diet, diet. It's got to be diet. And nothing ever really challenged that as a modality of healing. And it's usually one of the first things I go to, because what we put in our mouth really makes a massive difference to our health and how we're basically fueled up on a day-to-day basis. It's a great question. It healed my
Yep.
autoimmune.
Yep. Yep. Absolutely. Good question. Yeah, my oldest daughter has got celiac, and Dr. Schwager was the one. And I was fairly new to the school. This was probably back in 2006 when I started the school. And of course, I'm shy. I don't know anybody. And, we have my husband's insurance who is sending us from one doctor to another doctor to another doctor. And they're all saying, I don't know. I don't know. This test came back negative. This test came back negative. And then we saw our last doctor, which was a gastroenterologist. And I remember her saying, I've been in practice for 30 years and I don't know all the answers, but I would recommend that you see a naturopath. And I was like, okay. So it just so worked out that way. But it was, yeah, food is definitely medicine, because she doesn't have a problem today. So yeah. All right, Doctor, well, tell us, what is an average day for you? What's a day look like for you, or a week?
Yeah, sure. A typical day, I usually, my first patients are generally around 9 o'clock.
Okay.
I'll get in between 8 and 8:30, spend some time making sure that, if it's a follow-up patient, for example, going through my chart notes from prior visits, making sure I'm very well prepared for whoever comes in. I never wing it.
Okay.
and then if it's an initial visit, just preparing my charts, thinking about some of the things I want to ask these patients. So I spend about 30 minutes or so doing that in the morning. I see patients from 9 to 5. A typical day for me right now in year 5 here is about 5 to 8 patients, depending on the day.
Okay.
Typically get 1 or 2 new patients a week. But yeah, and then take lunch
Okay.
midday.
Yep. Of course.
And then at the end of the day, I usually try to block out a half an hour or so, just trying to wrap things up. One thing I learned is that when you go, oh, I'm tired, I'm gonna go home, and then you never tend to go back to the chart until the next time
Mm-hmm.
you see the person. I'd hate
Mm-hmm.
that something's missing, and so I just go through my charts, wrap them all up, and then I say sayonara and
Very
go home.
good.
But
Very
it's
good.
pretty
So,
busy.
okay.
Yeah.
So you work 5 days a week, all week?
I do.
Okay.
Wednesday mornings I take a couple hours. I'm in a networking group. It's one of the ways that I help prospect for business. It's a referral marketing sort of thing. And
Okay.
then on Fridays our clinic just closes at 2 o'clock. So I'd say I probably work. I mean, it's all work, but and even on Fridays I'm spending that extra time after hours, just preparing for the next week or
Very good.
doing some things. So.
Very good. Very good. And you said there's 5 or 6 other NDs in there with you.
There are 5 other doctors here.
Okay. So I guess my question would be, do you kind of bounce ideas off of each other? I mean, I know for instance, I know Dr. Chambers has been there for a very long time.
Yes.
Do you all focus on treating your patients the same, or do you have a different, or do you all kind of have your own niche? I mean,
Yeah,
how's that
that's a
work?
great question. I would say one of the benefits of being in a practice like this is that I do have the other doctors available as resources. I think we're all great generalists. We were all well trained, but each one of us has a different specialty. So Dr. Chambers tends to do neurodegenerative disorders,
Okay.
musculoskeletal disorders. He does hormones. Those tend to be in his wheelhouse. I do gastroenterology in a lot of men and women's hormones. We have a doc who specializes specifically in female hormones, another one that does
Okay.
more pain management. So
Wow.
it depends. I think the benefit is Dr. Chambers kind of envisions us as kind of a naturopathic Mayo Clinic of sorts, where you have
Okay.
people with different specialties. So you can go, or you have the hive mind that can get together and talk through some of these things. I work with like Dr. Jake Pasenka, for example, who's been
Yeah.
a
Yeah.
naturopathic doctor for 20 years and had his own
Yeah.
practice. And everybody has different levels of experience and different knowledge, and we all end up teaching each other things, through our own experience. So it's very nice. I never get lonely here, which is also good. And with the collective, we also are able to have more modalities here, like an IV lounge and some other things that other clinics may or may not have. And so it just kind of adds to the repertoire.
Okay. Okay. Very good. Did you ever think of going into your own practice by yourself, or have you
I
always
think when
had
I
that
was a
group practice?
Yeah, I think when I was a student, probably in that 4th year, I was starting to panic a little bit, and go, oh my
Okay.
gosh, what am I going to do? And I started to kind of pull that together in my 4th year, saying, okay, if I am going into practice by myself, what does that look like? Where do I set
Okay.
up? What are the considerations? I do have a background in business, so it wasn't
Mm-hmm.
too hard, but it was also like, okay, who do I need to know? What's out there? It helped me direct my questions to the Career Center at Sonoran University,
Okay.
because it is frightening. You don't, you're in a brand new job and people expect you to have all the answers for them. And sometimes those people are coming in to see you with, and it's a pretty dire, situation. They've been to all the doctors, they've done all the things, and they're looking at you.
Yeah.
And if I had a nickel for every time that I was thinking, my gosh, do you know I've only been doing this like a month or 2 months in that first year? But it's also interesting because because of the way that we're trained, we see things differently, and the treatments present themselves, like the treatment plans present themselves. So it does work. At this point, no, I
Right.
haven't considered going into solo practice because I feel like I'm building my own practice within our clinic. Our clinic model is more like W-2 employee versus like a contractor situation. So I like being part of our clinic as a whole and having those resources, and also just being in a position where I am independent enough where I can build my own sort of practice here, like with the gastroenterology or men's health.
Very good. Very good. Do you have and I would believe that all NDs do. Do you feel like you have a pretty good relationship with outside traditional doctors? So if you needed to
Mhm.
refer somebody,
Yeah,
okay,
for sure. And I think, as long as you're, so we all study the same medicine the first 2 years.
right,
We even study a lot of the same clinical medicine, the medical algorithms, but while they're going off and doubling down on, surgery residencies and things like that, we're doubling down on clinical medicine and really how to, treat people and get the best results. Everybody wants the best results. We just come at
right,
it differently. And so I think, when you can talk in the same language, for
okay,
example, it's not in our scope to scope like in a gastroenterologist. I can't do, as a naturopathic doctor in this state, we don't do colonoscopies and endoscopies. So you have to have your chart notes speak the same language as these people so that they understand that you're on their team and that you're really trying to get the best outcomes for patients.
got it.
So that helps immensely. I had a patient, for instance, with diverticulitis, and the standard of care for that, once that starts to present itself, is to an antibiotic and antiparasitic, Cipro and Flagyl. And this person I sent to their gastroenterologist to get a colonoscopy, and what did he put you on? I was like, oh, I'm on Cipro and Flagyl, and he's like, oh, good. So that tends to be, you do get a little bit look askance, but once you start speaking their language, it makes a massive difference. And then there are other doctors who learn things. I was at a continuing education. It was a dinner, and it was meant for MDs, but it had some gastroenterology components. So I went, and there were a handful of NDs there, and we are all kind of sitting together. And the MDs, oh, nice to meet you, that sort of thing. And then they did their own thing. And then when the discussion of like CBD and other herbs came up, they're like, oh, wait, you're a naturopathic doctor. What do you think of this? And it was all stuff for themselves.
Right,
But,
right.
once you started talking about it, they were all in and all about it. And so, they learn things from us as well. And I have a lot of docs on the outside where it's a very good partnership in that way.
Good, good, good,
And I
good.
think we
It's
had a
all medicine.
question. I keep
Yeah,
seeing Melissa
Melissa.
raise her hand,
Yep,
so
yep.
I don't mean
Go
to take.
ahead, Melissa.
No, you're all good, all good. I just wanted to ask if you could talk a little bit more about the career changing. If you would if you had to do it now, start school again, would you still do it? Like, how late is too late? Like, I feel I
Yeah,
want to do this. I can't get it out of my head, but I'm just like, and I started my prereqs because I didn't take any science in school. So I have 6 years
me
of
too.
school.
I blew
Oh,
them
good.
all off. I took physics for the non-scientists, and I showed that to Jane, and she goes, no way. So I had to go back and do my prereqs. I will say, so to answer your question, would I do this again? Absolutely, 100%. I was in a 20-year career in corporate America, and there was really nowhere else to go. And I saw people, and I was in my late 30s at the time, early 40s. I saw a lot of my friends getting laid off at their, 50s and mid 50s. And, it's a dead end. And the job was changing. Social media was becoming a bigger deal. Someone could hire their nephew for, $10 an hour versus somebody making six figures. You can hire a lot of nephews at that rate. So, I'd always wanted to be a doctor. I was in a position to plan ahead. That would be my best advice, is plan ahead, financially, emotionally, doing whatever you have to do to make it work. I took that year to go and get my prerequisites. I told myself that I was able to negotiate a contracting arrangement with my employer, where I was still doing some work for them, but I was also really going to school at community college full time to do all my sciences.
Mhm.
And I told myself that, hey, if I get into this and I really enjoy it, I will carry on with it, and I will put in my application as CNM. I said, it is not the way my brain works, if I can't handle it, if it's going to be too stressful. It was really kind of a litmus test for how well am I going to be able to tolerate, medical school. It's a big deal. I always say, I went from stressful job to stressful medical school, like who does that, right? However, what it did enable me, one, I got super passionate about what I was doing. Two, I'm in control of my life from here on out, as far as work. I could do this until I'm, 100 years old if I want. There's no corporation, saying, hey, thank you for your services, here's a severance. I get to build this on my own. And it's something, like I said, I'm very passionate about, and I learn a little something every day. I also get to help people directly. I had a job where I was a spokesman. I'd help, I'd say something and, people would learn when their power came back on. It was kind of faceless and nameless. I help people on a direct basis right now, and it's really exciting. I love it. I jump out of bed every day. Maybe not jump, but I get out of bed every day really enjoying what I do. And I'm really excited to, help solve the puzzles that my patients come in and present me. Some are easy, some are more difficult, and learning how to navigate that is pretty amazing. But yeah, that jump it's scary. Me throwing away, I thought I would be throwing away, because it's so different. Communications and medicine are so different. I thought I'd be throwing away a 20-year career and an investment, of going up the corporate ladder for 20 years. I thought I'd be throwing that away. As it turned out, I use all of the skills on it every single day. I really put my nose to the grindstone, with my first 2 years in the sciences, and passing those boards. Once I got into the clinic, being an older adult, being somebody with a professional background, was a huge asset in dealing with patients, to the point where the patients who would come in, much to my embarrassment, a lot of the patients would come in, and when you're a third year, you shadow, in the fourth year, you take their notes. You're on a shift run by a doctor. There's a group of students in the room that help with the cases, but but the patients would have a fourth year interviewing them, and then they would turn around and ask me if I was, oh, Dr. So-and-so, Dr. Gaines, what do you think? Or, Dr. Axelrod, what do you think? They thought I was the doctor. And when I became a fourth year student and started interviewing patients and doing the intakes and stuff, all the skills that I brought to bear that I thought I'd been throwing away were actually of like incredible use. And life experience is also incredible use too. There's things that come up that you've seen just as a human being living life that others have not. So it's a really great, if you're courageous enough to make the pivot, and you're passionate about what you're learning and what you're doing, I think that it's entirely possible, because all the skills that you've brought to bear to date will come into play, and it's pretty great. Like I said, I love my job.
Yeah.
Thank
So
you.
well said. So well said. Thank you. And Melissa, we get phone calls every day that people are scared to take this career change. I've been a teacher. I've been in education for 25 years. I love what I do, but I don't love it enough, and now my kids are older to where I can, go back to school and start those prerequisites. And I mean, we have some good conversations with applicants that, am I too old? And I'm like, never too old. If this is something you're passionate about, and this is something that, you're going to love your job, why not be happy? So, I mean, I love my job, so yeah. So I'm glad, Dr. Wool, this is, we haven't had, I don't think we probably did maybe the first season where we had one of our alum that this was a career change, like a career change where you've spent 20 years in corporate America. So that's a big deal,
And it's not unusual. I want to just
Right.
point that out. I'm not a unicorn. I had conversations with people, doctors just like myself, who are like, yeah, I did 5 years at a Anderson Consulting, and then I changed. I did XYZ. I worked at these kind of companies, and You
Right.
know, I was a
Right.
biology major and I always loved when I came back. You know, everybody has a story. I would, and Jody and Jane can back this up. I think there's probably a minority of students who go right from college right
Oh,
into,
yeah.
you know, Sonoran University is probably a
Yeah.
minority. People are doing other things, having other interests, and everybody brings those into the
Yeah.
university when they're there. So,
Yeah.
but yeah,
Yeah.
I was deep. I was pretty deep. But just
Yep.
because you have a 20-year career somewhere doesn't mean you can't have a 20-year or longer career doing something else that you're even more excited about.
Yeah. Do what you love. Do what you love. Absolutely. So, Dr. Wool, on that line, what is the most challenging part of your job?
Mm, good question. I think it's really when I don't know something.
Okay.
On the one hand, I've gotten very good at communicating with my patients that like I don't know this, but it's an opportunity to learn. Early on, there were with gastroenterology, there are conditions that are life-threatening, ulcerative colitis, Crohn's,
Right.
diverticulitis, things like that. Those frighten me. If somebody came in on a discovery call, I was like, back away.
Yeah. Yeah.
But you end up learning is that what you end up learning is that those are opportunities to learn. They're opportunities to really double down. What I really enjoy about my job is going to the mat for my patients, really trying to help them get well because oftentimes they're not elsewhere. And so you really do the homework, you do the research, you find the solutions, you talk to people, other docs, and really try to understand what's going on. So it becomes less of a challenge, you know, and those are the things that I really enjoy, but it's always a challenge when they pose something that you don't know.
Right.
It'll poke that imposter syndrome really quickly, but also what I've learned is it's an opportunity to learn. And those are some of my best and most successful cases, frankly.
Awesome. Very nice. Very nice. All right, let's trigger back to, and if you guys have more questions regarding practicing and being an ND, by all means, ask the question. So let's trigger back to being here at SCNM or Sonoran University. Do you feel like you were supported enough, or do you feel like the curriculum supported you enough to go out into practice?
I think so.
Yeah.
Definitely. It was definitely a supportive environment. I really enjoyed it. I think all the professors were all very available and very,
Okay.
they're very mentoring, you know, everybody that I had was really excited about what they did, and they're excited to help you connect the dots and learn what they were proposing. Because look, it's medicine. It's not easy. You know, biochemistry is not easy for 99.9% of people. Like, you know, and so to be able to have the opportunity to talk with somebody and go, hey, what's this or what's that, or what do you really need to know in the real world, is really, really important. It's an incredibly supportive environment in that way. And so I felt that. I also think, you know, Jody, like what you and Jane and, you know, the loan office and everybody else in management are also very supportive too. Everybody wants you to do well. That's it's cultural. It really is. You know, you made this big decision to go to medical school, and it's, you know, they want to support your decision to make you the best possible doctor on the other end as possible. You know, the best as possible. And you know, I really felt that going there. And, you know, the other nice thing is that the camaraderie with the students, you know, you're all in it together, and you're not going to whatever Harvard Medical School. You've chosen a really unique and exciting path, and everybody's kind of in on it, you know, and it's pretty cool. It's naturopathic medicine is unique, and by the way, growing, particularly post-COVID, where everybody is like, I don't know what we're doing here, but we had all the answers. I'll tell you from seeing COVID, for example, like 1,500 times in our clinic, like we knew exactly what to do with it, you know, when nobody else did. And like that wave is starting to cross. This is a perfect time to go out and become a naturopathic doctor.
Wow. Good to
Sorry
know.
to overhype that, but it's true.
No, good. And that's what
I believe it.
Yeah.
All the prevention work and the, you know, a lot of those core principles of naturopathic medicine are now coming to bear in the general public. And it's pretty cool. need to.
Yes. Yep, absolutely. So, I mean, as Jane and I talk to applicants every day, we tell them, you know, this program is like drinking from a fire hose. It is intense. What do you think of the curriculum? Do you think it was as hard as you thought it would be?
Yes.
Okay.
I don't know. I'm like a B type, A type. I'm an introverted A type, I guess. It's like
Okay.
I'm very competitive with myself and I want to learn absolutely everything. And so if somebody gives me a chapter to read, I'm going to read the whole thing and I'm going to outline it and take notes and do all these things. That was the fire hose part of it. As you go through, I don't know if it was Jane or somebody else who said this. It was like that Pixar movie Finding Dory, and Dory is a fish,
Just
and
keep
the
swimming.
phrase
Just
that
keep
keeps coming up is keep swimming, because eventually you whittle down what is you dive into what's actually useful versus what's
Mhm.
too much. I be honest, I was after the first quarter, I was really courting burnout. I was doing too much, but again, these are opportunities to talk to people to say, hey, I studied all this other stuff, and they go, oh no, you look at this and look at that, and then you start to dial in your own methods and styles. You meet other students who are really good at different things, and complement your strengths and bolster your weaknesses. And it after an initial like everybody being new sort of thing, it really starts to click into gear, and you start to roll forward. And then of course I think it one of the professors says it's like parachuting into China without knowing Chinese. You're learning an entirely different language. And it's hard and it's frustrating, frankly. There's a lot to learn there, but and at the same, it's like you're driving the car and building it at the same time for a little while there at the beginning, but it softens up. While the subject matter may be new, you find the right ways to attack it and to cope. So I would say after that first maybe quarter, that things
Okay.
lightened up quite a bit.
Okay, that's what we tell them. That's what we tell them. So Alexander has a great question. Do you think the curriculum adequately prepared you for your board exams? How much time did you spend outside of class studying and doing coursework?
The science boards, the school changed while I was there, and they have these capstone
Yep.
type exams, and they're really gung-ho on everybody passing and doing all the right things to pass. So I would definitely say I was extremely well prepared. For the clinical boards that you have to pass after your fourth year to get licensed, the trouble isn't the school preparing you or not. It's just that you have learned so much in 4 years. You really got to organize your brain around, okay, what are they actually going to ask on the boards? What do we really need to know here? And and I would say basically after I took some time off after I graduated, and it was just 2 months straight of just studying every day. And there's board prep books and all these other things. And so, other students that we group together and, knock the stuff out. It was actually kind of fun. And it was also kind of a nice reminder of like, oh yeah, we learned that. That's so right. Like, oh yeah. And it really, it's really great. And did it prepare me for, practice? Absolutely. Do you forget 80% of it on day one of practice? Absolutely. A common cold will come in and you'll be like, oh my gosh, what do I do? But then, you stop and go, okay, this is what we do. I know this, or that you had notes, from something. You went, okay, that, so yeah, it definitely prepares you, to be a great doctor. Yeah, I think
Very good.
I never felt like I was unprepared for any of it. I really didn't.
Very good. Very good. Grace has a question. Is there anything you would recommend doing to prepare for the curriculum prior to attending Sonoran?
As I mentioned, I hadn't done any science ever. And so really understanding the science. the way it worked is the prerequisite was like biochemistry, but you have to take organic chemistry and Chem 1 and Chem 2. You had to take a bunch of chemistries. So
Yeah.
just really making sure that I mastered what was required to get in, and then kind of keeping my ear to the ground and like, oh, okay, I'm going to need to know some of this stuff, when I get there. I think the preparation isn't necessarily for the curriculum, it's for when you're done. Making sure that you realize what's waiting for you on the other end, both as somebody who's going to be running their own business, essentially. Where's your money going to come, your income going to come from? How are you going to run a business? Do you have enough, do you have everything organized properly to, get yourself through, housing and all the other things that the office is so great in handling and counseling on. Those are the things that really require the most attention. And again, like I said, planning ahead is everything, but you have a lot of help.
Yeah, I agree. As an ND, are you able to prescribe?
Yes, it is one of the great things about being in a licensed like Arizona. Here in Arizona, it's the longest licensed state for naturopathic doctors. I believe it's since the 1930s.
Yeah.
So from that standpoint, we're treated more or less the same as MDs or DOs, which is awesome. The other thing is I do hormones. There are other medications, for example, that are controlled substances. You can apply for a DEA license. And it's a 3-year license. I think it's like $900 for the 3 years, and you can prescribe controlled substances. For example, I do men's health. Testosterone is a controlled substance. It requires the DEA license. So as long as you're a licensed naturopathic doctor and you're keeping good track of what you're prescribing and and what schedules you're in and all that sort of thing, you can prescribe. I prescribe every day. I never thought I would. I thought, oh, naturopath,
really?
it's at the end of our therapeutic order. We're going to do all the general stuff and work our way up. But, sometimes you need to give pharmacology, and you have to go to the pharmacy, and that's just the way it is. The other permutation of that's interesting. Yes, you have to renew the DEA every 3 years. Just to answer the question in the chat there.
Okay. Yep.
Thank you for that. The other permutation of that is that, we work a lot with compounding pharmacies. These are pharmacists that are kind of old school. They make the medicine. And so you can work with pharmacists to make different things. I've done like creams with herbs and things in it with medication for things like eczema. When we do a lot of our hormone concoctions, we can combine different elements into like a cream or a serum or a gel into a capsule. It's really great. And having that prescription as a naturopathic doctor, you're looking at that big picture and using that thought process, that creativity, and it really complements something like a compounding pharmacist who has a similar thought process and said, oh, we can put this with this and really help this person. And so that's really unique. I don't see a lot of other doctors besides the naturopaths and maybe some DOs doing the compounding. So it really helps. We can also, just to answer the other question that's in here, can we prescribe peptides? Yes, there are compounding pharmacies that do peptides and peptide therapies, and we can do that. Dr. Chambers and Dr. Smith here, for example, will get those and do them as injection therapies. I will use them, BPC 157, for instance, as a gut health therapy. Sometimes it's a supplement, and sometimes it's something you order from a compounding pharmacy, but you have to be licensed in order to prescribe those things. So
I didn't know.
My take on peptide therapy, it's an area where naturopaths do very well because it's new and it's cutting edge, and we have the freedom to kind of dive deep into the research and and prescribe it as part of a more robust treatment plan, as opposed to just following a simple algorithm that ends in a drug.
So, not being a medical student, can you explain to me what peptide therapy is?
Yeah, thank you. I should have said that.
No.
So peptides are chains of proteins and amino acids that have very specific effects on our on a certain organ system, for instance. Often they'll reduce inflammation.
Okay.
I mentioned BPC 157, for example. That peptide is, you can take it orally, and it helps to heal up the tight junctions of the gut that might be inflamed.
Wow.
In general,
Okay.
it's new. Instead of having like a whole medicine, they kind of just snip certain pieces of something that exert a very specific effect. It's kind of a new and emerging, therapy, and it really, really helps.
Wow. Great. So how would you get licensed for being able to use peptides for patients?
Yeah, that just comes with your general pharmacological license.
Okay.
When you're a licensed physician, you apply what's called for an NPI number. You get that enables you to prescribe. Like I mentioned, you could also apply for a DEA license as a controlled substance. Peptides are not controlled substances. Oftentimes they're just supplements. In
Oh,
this state, you need a license to dispense, which you get from the Corporation Commission. Not the Corporation Commission, but the Naturopathic Medical Board of Arizona.
okay.
You apply for that every June or July. I believe it's $225. So if you're giving supplements or those sorts of therapies, you have to have a license to dispense to give it
Okay.
out to somebody else. And then you have your naturopathic medical license, which has to be kept up to date every year. Usually every December, you'll renew that. I think it's 165. So as long as those things are all in good standing and you have the NPI number or sometimes the DEA number, if warranted, you can prescribe medications.
Oh, interesting. All right. Does your office accept insurance or are you all cash based?
We're all cash based. The
Okay.
instances where we can take insurance sometimes are labs, just
Okay.
general wellness labs, for instance. We can code those up and send them into insurance. We have a lab here in our office, which
Okay.
is, it's probably fairly unique. But in general, yeah,
Okay.
some labs go through insurance, but generally cash pay is the way to go. I'll also say it's a blessing. I think if you go into
Yeah.
any doctor's office, they have 4 people, 3 people, all calling insurance companies and tracking down claims and trying to get
Yep.
money, get paid. And I don't say that with a chip on my shoulder or anything. It's the truth. Insurance creates a lot of hassles and operations for a practice.
Yeah. Yeah.
Sometimes that's
Yeah.
rewarding depending on what you're in. Others, it's not. So cash pay is actually a blessing.
Yeah, it is. And insurance can be brutal. When I first
Yes.
got my first job was in a dentist office, a pediatric dentist office, and that's what I did was insurance, and it is brutal. It is. And
A
that's
lot.
exactly what you're doing is you're contacting the insurance company every day and trying to get claims processed. Yep. 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 All right, so we have a couple more minutes here for any last minute questions. Dr. Wool, what kind of advice can you give to these students? Some students have just submitted their app, some have interviewed and have been accepted. So some are for spring, some are for fall. What advice can you give?
I think again, one, get excited.
Right?
Because it's a great journey. You're going to meet some incredible people. And eventually, once you're a licensed doctor, you're going to help people in a way that it's so profound that you wouldn't have imagined. And they'll be asking like, where's this been all my life?
Right.
I think we're in a great position, and what's going on with society right now and how people think about medicine. So there's that.
Mhm.
The main thing I think is plan ahead financially, plan ahead, emotionally, make sure that that you're in the right frame of mind to go forward. But I think that if you've applied to naturopathic school, you're already pretty interested in it. And it's a very exciting journey. There's ups and downs, but mostly ups. And I know it's been amazing for me.
Awesome. So Sierra has a question in there. How well did Sonoran prepare you for working with hormonal
Mhm.
dysregulation, or did it take a lot more continuing ed afterwards?
Yeah, both.
Okay.
You take endocrinology as part of your sciences. You take it as part of your sciences and also part of your clinical science. There are shifts in the clinic at Sonoran that focus specifically on hormones, so that when somebody calls the campus medical center and they say, oh, I'm interested in hormones, or I have XYZ, types of symptoms, after they're screening them, they end up with the students on the hormonal strip. I was lucky enough to show Dr. Cronin and others while I was at Sonoran. And I also, the school encourages you to talk to people who are doing those sorts of things as well. You can go shadow doctors. Sometimes you can get it as an offsite, approved as an offsite elective or offsite clinical hours. And other times it's, it's something you can do on your own to say, hey, is this something I want to do? But yeah, they prepare you pretty well for that. It's part of the curriculum. How did I plan financially? I really, I really did a couple things. I mean, one, I was in a different position than probably most of the applicants. But one, I really made sure that I, saved some money, so that if my school loans fell short in a given quarter, that I had enough to live on. Again, remember, I had 2 children and a mortgage, so I needed to make sure I looked at my expenses. I looked very hard at what I can live with and what I can live without. And I made a budget and I stuck to it. And the other thing I did was to make sure that I was putting aside money for savings for those emergencies, number one, and also so that at the end of 4 years, there's a gap between when you graduate and when you become a licensed physician, that you can cover any expenses once your loans, might stop coming in. So I made a budget and I stuck to it really rigorously. Came with some sacrifice, but it didn't sacrifice what I was learning or any of the fun I had while I was there. But it was something that I really made sure I had tightened up before I got there.
Good advice. All right, we have 4 minutes, guys. If you have any last minute questions for Dr. Wool, if not, we're going to be respectful of his time and let him go back to doing the amazing things he does. All right, no other questions. All right, very good. Dr. Wool, it was a pleasure having you today. As always, it's always good to see you. Please tell, let's see, Dr. Chambers, I know, you said Jake Pasenka, right?
Yep.
I know him, but
Yep.
I think he graduated right after I came or something like that. So yeah, please tell everybody I said hello.
I absolutely will. Say hello to Jane for me.
Right, I
and
will.
Thank you everybody
will.
for attending.
Right.
You can reach me at drwool@chambersclinic.com, DRWOOL. If you need any extra questions answered after this call. But Jody, thank you so much for hosting.
You are welcome, Dr. Wool. Have a great day. All righty.
Take care.
All right. Bye-bye. All right, Alexandra, let me stop recording.